All right, good morning. Everybody feel good? It's Sunday morning. Many Sunday mornings, I would have felt like a failure if I was not in my bed at this time. So thank you so much for having me. And I just want to say to the organizers, thank you for hosting this. I think the focus on advocacy in medicine, it's funny that those two things have to be reunited. Because if you look at the history of our craft and the work that we did, it was always very clear to practitioners of medicine that there was a real social responsibility toward the work. And somehow, somewhere, we got the idea that medicine was this sterile thing, that somehow science and politics just don't mix because, you know, science is science and politics is politics. Rudolf Virchow, who's someone I very much look up to in our history, was someone who said that in the end, medicine is politics on a grand scale. Politics is medicine on a grand scale. It's Sunday morning. And I think it's time for us to really be asking ourselves what the broader responsibilities to the craft and to the work really look like. And so I'm thankful that this conference is happening, that there are so many people here, and the opportunity cost of this, as we talked about, is quite high. I want you to ask yourself a very simple question right now. Why did you become a doctor? Complex question. At some point, most of us said, you know, I really love people. I really love science. Pay's not bad. Nobody ever looks at you and be like, what are you wasting your life for? Ask yourself deeply, deeply why you became a doctor. I'll tell you why I became a doctor. I grew up between worlds. My father is an immigrant from Alexandria, Egypt. His mom was the wisest, most intelligent human being I have yet to meet in my life. She never got to go to school. And she was illiterate, raised 6 kids, 1-bedroom apartment overlooking a fish market where her husband, my grandfather, sold vegetables every day. And he had an 8th grade education. My dad walked a path that would leave him every night on the rooftop of their building, and he would be studying by the light of a lamp across the street because he did not want to walk the same path that his parents walked. And that path led him to the opportunity to leave Egypt and go to one of 2 places. For him, it was either going to be Bayreuth, Germany, or Detroit, Michigan. And the only 2 similarities between Bayreuth and Detroit is that they're both places where people make cars, and my dad's an automotive engineer, and they both end in the sound Reut. And my dad took a bet on a Detroit that was in the United States of America, because for him, per her founding document, shouldn't matter the color of his skin, how he prayed, that he could be as a Muhammad just as American as a Steve or a Mike. So he took a bet on that America back in 1978. Met and married my stepmom, Jackie, born and raised in the middle of the state of Michigan. Literally, there's a plaque in her hometown that commemorates the fact that St. Louis, Michigan is in the middle of the state of Michigan. And she's a daughter of the American Revolution, 6th generation Michigander. And so Muhammad and Jackie are the people who raised me in this world. And so you can imagine the antics that ensue. And so I'd spent a lot of my summers in Alexandria hanging out with my grandmother, my grandfather, my aunts and uncles, and my cousins. I'd come back in the middle of the summer to a place called Montcalm County, Michigan, in the middle of the state where my family's had a cottage on a lake for the past 60 years. And one of the things you come to appreciate is that it doesn't matter if your grandmother never got to go to school, raised 6 kids in a 1-bedroom apartment, and doesn't know how to read, or your grandmother's a nurse who raised her 3 kids in the middle of the state of Michigan, that when your grandmother kisses you on the forehead, tells you to eat a little bit more food, in my case, eat a little bit less food, tells you you're being an idiot for whatever it is you did that morning, is done with the same love. And for me, that love, that empathy, that humanity, and the ability to see it and the way it manifests across different worlds, I knew I wanted to serve that. And I also loved science. Both my parents are engineers. You know, I was raised by an immigrant father, so for us, there was technical work and whatever else everybody else did every day. And so I loved science. And so I thought I wanted to use science to help people. I went off to the University of Michigan with the goal of becoming a physician. And I met a friend of mine who was about 3 years my senior. He was on his way to medical school. He gave me some great advice. He said, listen, Abdul, you'll get to medical school, You just gotta, do well in your classes, do well on the MCAT, do some interesting stuff, and you'll get to medical school. But the real question is, this is the one moment in your career you're gonna get to study whatever it is you want. And so you should study what you love. So I took a smattering of courses that first term, and I decided I loved biology and I loved politics. Now I came home to my dad, and end of that first term, and we get to talking, and I said, Bubba, I've got it figured out. I want to study biology and politics on my way to medical school. Now this is to a man who made it out of Egypt being very good at one thing. He just looks at me for a minute, he says, Abdurrahman, I think you're very, very confused. And then when I decided to run for governor, he's like, you are very, very confused. Here's the thing. They're not as different as you otherwise might think. Because if biology is a set of rules by which our cells make complex decisions about scarce resources in our bodies, politics is just a set of rules by which our communities make complex decisions about scarce resources in society. And you all know that it's not the biology that usually shapes who gets sick and who doesn't. It's usually the politics. Whether or not people have access to a very basic set of resources. A good job that pays a living wage, that puts a good roof over someone's head, puts clean air in their lungs, clean water in their cups, allows them to walk in their communities without being victimized by either a neighbor or the state itself. Those are the things that pattern health and disease. And in medical school, I went to med school not too far from here. I had done a PhD in public health at that point, had a real good understanding of the systems that shape access to health and disease, but I hadn't given up on a clinical career. And I was doing a sub-I at the Allen Pavilion Hospital, just northern tip of Washington Heights. And I had two experiences. One, I got to take care of a woman named Ms. G, that's what I'll call her. Ms. G had fallen and hit her head. She was drunk in the middle of the day. It was February. And I met her when she was in the ED. And Ms. G was yelling at me. She had this big, beautiful baritone voice, and you can imagine had life played out differently, the first time I would have heard that voice would have been on the radio or at a show. But instead, she was yelling at me. And Ms. G had been there for 3 hours, and if she was drunk in the middle of the day, she's probably an alcoholic. So what happens when you keep an alcoholic from the bottle for a while? Start to withdraw. And she hadn't gotten a CT for 3 hours. Fell, hit her head. You could see the welt. And I go to talk to the resident ED doc. He said, look, we're just going to let her go. I said, why? You didn't do a CT. That's like standard of care. If I hit my head or you hit your head, the first thing they'd have done was gladly bill us for that CT, right? I said, well, look, it'd be a social admit. So I just sat on the admission, right? I went, had lunch, rounded on my patients, hung out, did some other things. And by that point, I'm getting hammer paged by both the ED and my attending. What the fuck are you doing? And I was like, wait, what? I'm so sorry. We admitted her and got her that CT. Thankfully, she was fine. But here's the thing. She had full-blown AIDS and out-of-control diabetes. And she had this paradoxical hypotension, because one of the things that HIV does is infests the adrenals. And she had an actively bleeding pelvic mass. Nobody took a history. Why? Because she'd have been a social admit. Took care of her for 2 weeks. And I learned a lot. And she became, for me, a referendum on my career in clinical medicine. Could I support and help? Could I do the things to solve the problems that society had built for a very long time with this one patient? Could I be that hero doctor? And organized this huge, elaborate dispo. She was going to go to rehab for 2 weeks, the only rehab that took HIV-positive patients. And then from there, we had hooked her up with housing that she had fallen out of because her drinking had gotten so bad. And it was all set, right? We had consult after consult. She was ready to go. And the day of discharge, went through the plan for like the 10th time. And she said, I'm going home with my daughter. I said, wait. I asked you if you had kids. You didn't tell me you had a daughter. She said, yeah, I got 4 of them. I said, well, when's the last time you talked to your daughter? She said, about 2 years ago. I said, well, what happened the last time, the relationship doesn't seem like it's on the firmest ground. She said, well, I started drinking again. I said, well, what makes you think you're not going to start drinking again this time? She said, well, you guys fixed me. I said, no, we didn't. This is something you're going to deal with for the rest of your life. And I think these last 2 weeks were a good start. And there's going to be a lot more work to do. And she said, look, I want a relationship with my daughter. I said, I completely understand that. And I'm going home with my daughter. I said, ma'am, look, please, maybe you just do the 2 weeks of rehab. You get your housing set up. You can start engaging her on more firm footing. Usually relationships don't go so well when you rely on somebody you haven't talked to for 2 years for something as important as your housing. She said, you're not better than me. I said, you're right, I'm not. I said, I'm going home with my daughter. I said, okay. 2 weeks later, I had just submitted my residency application. And I was getting on the 168th downtown A. And I was going to have dinner with a friend. And I hop on the train, and who do I see sleeping on the bench? It's Miss G. So I went home and I pulled my residency application. Same 2 weeks. We had a new palliative care doc. She was awesome. Really good at end-of-life care discussions. But, the hospital had just built a new ICU. And so every bed that's filled by an ICU patient is one who's not on palliative care. And every person who goes to palliative care is a bed that's not filled. When an average ICU bed lies fallow, you know how much that costs the hospital every night? About $30,000. You know how much they usually bill for on average? ICUs are big money makers. And so within about 2 weeks, they realized that she was costing the hospital a lot of money and had her shipped out to a different hospital. And so I decided that maybe clinical medicine was not going to be for me. And I decided to go into academia, and I became a professor at the Department of Epidemiology at Columbia. Now, I loved writing papers. I loved research. The work was great, except for there were many days where you sat down and was like, does this actually matter? And I was at our annual Society for Epidemiological Research conference, and I was a junior professor. I hosted a symposium, and I get the senior professor walks up to me, a guy who didn't have the time of day for me like 3 years before. Sits me down and says, son, I want you to know something. I said, yes. He's like, this is impactful work. And I looked at him for a minute. I was like, this work doesn't mean anything. I literally was leading a symposium called Complex Systems and Causal Inference in Epidemiology, which is about as esoteric as it sounds. But the wine and cheese was really good. I don't even drink the wine. And at that moment, I realized I needed to get out. That's the opportunity that I had to leave. That's when I found the opportunity I had to leave academia and jump into public service. The city of Detroit in 2012, when it was facing bankruptcy, made the decision to shut down a 185-year-old health department in a city with a higher infant mortality rate than my father's native Egypt. And when that didn't go very well in 2015, they were looking to rebuild their department, and that's what I was hired to do. I was the youngest commissioner of health in a major U.S. city, and also walking into a department where I had no clue where to begin. I walked into a department that had 5 city employees and 85 contractors in the back of the building where people pay parking tickets in Detroit. Literally first day of work, right? I mean, like, get in the mindset, got my big boy suit on, my big boy tie, the commissioner. You're going to commission? You have no clue what that means, but I'm going to do it. And this guy walks up to me from the right. You? Yes, sir. You work here? Commissioner. Yes, sir, I do. Fantastic. Can you take my parking ticket in for me? I said, sir, no, I'm the health director. He said, why the hell are you walking to the parking building? That's a damn good question. Now, can you take my parking ticket in for me? I was like, yes, sir, I can. Got his ticket paid. I was like, this job is going to be a cinch. But in all seriousness, first 3 weeks, I had no clue where to start. And I was looking for some kind of inspiration, something to actually connect all the theory learning I had done to the practical facts on the ground of how you actually do the work of improving the health and well-being of 700,000 people who've been systematically marginalized and neglected by almost every level of government intended to serve them. And that's when I met a little boy. His name was Demarius. I was walking through our vaccination clinic, and I meet this 3-year-old kid, and he's just got this charisma. Most 3-year-olds, you guys have done a pediatrics rotation, where you meet a 3-year-old. 3-year-old looks up just enough to realize they don't know who the hell you are, and then bury their face back in their parents, right? Kid didn't do that. Looks right up to me, puts his hands out. I'm Demarius. Hey, Demarius, I'm Abdul. Gives me a hug, goes back to his mom. I was like, this kid is either the most confident or the most rational 3-year-old I've ever met in my life. But you think about the circumstances of his life. He was the 4th child of a 21-year-old mom. Met his father maybe 4 times in his life because his dad's in jail. This kid graduates from his underfunded, decrepit public school system in Detroit. His statistical probability of winding up in jail remains higher than it does of winding up in college. And then he had this charisma. And you contrast the difference between the two of those things, and for me, he defined public health in 10 minutes, faster than I'd had it defined in the 2 doctorates that I'd finished before him. Public health, and frankly government, if nothing else, ought to be about justifying the kind of confidence that any kid should have in the life that he or she is going to lead. And so we got to work. Our goal was to break down the barriers that kids like Demarius had to being able to learn and earn in Detroit like we'd want for any kid anywhere. Led us to doing things like building a program to guarantee every child a free pair of glasses. Standing up to some of the biggest corporate polluters in the state of Michigan. Forcing a petroleum refinery to invest $10 million of its own money to reduce its emissions when they had wanted to increase them, because in Detroit, our probability of our children winding up in a hospital with asthma is 3 times higher than the state average. And then there was the challenge of the things that the politicians didn't want to pay attention to. Our city shuts off 17,000 homes for water. Water in a state that is defined by its fresh water, the Great Lakes state. 85% of North America's fresh water is in the state of Michigan. And we can't get water into the houses of poor black folk. Needless to say, you all know what happened in Flint. Cities demolishing homes at the fastest rate in history. And those homes built before 1978 are laced with lead. And so we assessed that demolitions program and showed that there was an association between whether or not a kid lived within 400 feet and the probability of their testing positive for lead exposure. And guess what? There is. And when you brought that up to the city, they said, well, you know, go back and look at the data. So with all due respect, Mr. Mayor, this is what I did for a living. Politics weren't there. Meanwhile, Donald Trump gets elected president, and basically everybody of color in America is like, holy sh**, right? And I had to ask myself, what's my responsibility? What's my role? And that's when I decided to run. I didn't win. I mean, I've never put more of myself into something for 18 months and failed so publicly. That being said, I don't regret a second of it. Why? Number one, the people of the state of Michigan gave me an incredible gift. People are good. And in interactions in their living rooms and their union halls and at their town pubs, I got to see that one person at a time. People are good, even the folks who voted for Donald Trump. And the second thing is that the work of pushing values in the world, advocacy, we're all here for, that matters. Because the minute you have advocated for a thing, you have questioned the circumstances within which evil happens, the circumstances within which inequality is perpetuated, the minute you start asking those questions do not go away in people's minds. And they keep going, and they keep germinating, and they keep building, which then turns into action. And I want to leave you with a couple of, hopefully, pieces of advice. I had a mentor of mine who told me, you know, Abdul, he was a British guy, he was actually an Australian guy in Britain. He said, Abdul, there is no vice like advice. And then he always went on to give me advice. So friends, there is no vice like advice. But here's some advice. Number one, there's, I think, 3 kinds of advice. And oftentimes, we are burdened in our craft with the worst kind. I think the first kind of advice is advice that seeks to justify the decisions that the advisor has made. You should do this because I did this, and you seem smart, and so when smart people do what I did, it probably means that I didn't make a bad decision. We get that all the time. And it always regresses to the mean. Second, you are an X. I'm going to fit you into a bucket of other X's and give you advice to the median person. And then third, the kind of advice that actually asks where you are, what your trajectory is, and where you're headed, and then asks where you want to be, and then seeks to do the work of correcting between your current trajectory and the trajectory you want to be on. That kind of advice actually takes a lot of listening first. And I say this because A, do not listen to the kind of advice that seems awfully pulled from the CV of somebody who's giving you that advice. Advice that doesn't seem to appreciate who you are and what you want to do. And then lastly, advice that is unwilling to see you as somebody who can move further or do different than the person who's giving that advice. And then more importantly, do not ever become the kind of advisor who is too lazy, because someday people will look to you for advice. Do not become the kind of advisor who is too lazy to appreciate who someone is and where they're going. That's number one. Number two, our institutions, they validate us, they credit us. And the thing about institutions is that the thing that institutions do best is perpetuate themselves. Now, every institution has a mission, a vision, a set of values, and most institutions don't actually stick to those mission, vision, and set of values. They perpetuate themselves. And leadership is not just moving an institution or accelerating an institution faster in the direction that it's already going, although that's what the institution's going to validate you on. It's going to give you all the awards, going to pat you on the back so many times because you've accelerated the institution in the direction it's already going. The question becomes, are you willing to actually do the work of leadership to move the institution in the direction it ought to be going based on what it says it is supposed to do? And that often means that for a long time, you're going to get denigrated. You're going to get pushed down. You're going to be told you're crazy. You're wrong. Just go along to get along. We'll give you that award. Be great. And then I asked you early on why you all became doctors. Now, I know all the good reasons you all became doctors. I shared with you mine. But let's be fair and let's be honest about our career choices for a second. Nobody ever yells at you for going to medical school. Nobody ever tells you that you're wasting your life. Nobody ever looks at you and says, well, why would you do something like that? Doctors are respected. Doctors are appreciated. Why? Because oftentimes, most of us who select into medicine are too risk-averse to see the world any other way. I'll make good money, I'll do good work, nobody will ever question the nobility of what I do. But here's the facts. Our medical institutions, in so many ways, hurt people. Whether it is the doctor who's unwilling to give a poor, black, drunk patient a CT when she needs one, or it's a board of directors at a hospital who's more interested in making sure that the bottom line looks good so their bonuses go up, rather than actually asking what we do with all these resources and what would it mean if we were to actually invest those resources where they need to be invested. The question you have to ask yourself is, do you want a seat at that board of directors, or do you want to force that board of directors to pay attention to where you sit? Ask yourself honestly why you became a doctor, and then really, really, really dig deep about what it means to serve the greatest ends of the institution, not just to perpetuate it. Third, there is no choice not to be political. And I know I'm preaching to the choir. Y'all woke up on Sunday morning to be here, which is great. There is no choice in a moment like this not to be political. Politics is about the distribution of scarce resources. And insofar as we have people who suffer disease that is unnecessary, and those people who suffer are patterned on some very, very clear markers, be it the color of their skin, be it where they grew up, be it what they make, what their parents did, who they love, how they identify, how they pray, then we've got a real responsibility to ask, what is the circumstances of our politics that perpetuates institutions that drives this inequity? And if we're not doing that because the institution is telling us to shut up, we've got to ask ourselves what side of the moral coin we are on. Because right now, there is no sitting in the middle. There's just not. When you see evil happening and you choose not to run to it, you allow that evil to persist. Martin Luther King talked a lot about that. And then the last point I'll just make is this. The most enlightening thing about medicine is that it actually forces you to sit with people. It teaches you a set of skills around listening to people in pain and also speaking with people in pain. Those are rare. Most of the time when people are hurt, it's easy for us to run away. How often is it that you talk to somebody who's in deep pain and they're complaining to you and you're like, this is a lot. I don't want to have to deal with this. In medicine, that's your job. Your job is to deal with it, literally. And somehow we allow ourselves not to extend that empathy beyond the clinical or hospital walls. And right now, more than anything else, the world needs people who understand how to listen and how to engage in pain. And it's not just the pain of people who've suffered inequities for a really long time. Because oftentimes the thing about pain, right, the pain of a small cut versus the pain of cancer, it's pain. And we've got to be able to actually engage people and think about what it's like to be in pain, wherever they are in pain, and still have a conversation about what the truth is. One of the most courageous things that doctors do every day is to sit down with people who are in pain and say, I understand that you're in pain, and you know what? It might be that the treatment that I offer you is going to put you in more pain, but in the end, it is what's best for you. We do that all the time. Surgery is literally the creation of pain. You literally cut into somebody's body. Shit hurts. The question is whether or not we're willing to do that as a society. Actually have a conversation with people who are in pain and say, the thing that you think is causing your pain, that's not it. And unless we are all willing to come together around a structure that does not allow those powerful institutions to dominate the means of our lives, then all of us are going to continue to be in pain. And you know who we're going to think caused it? The other person. At work has never mattered more. Physicians are at the precipice of having those conversations. The question is whether or not we are willing to move beyond all of the risk aversion that led us into this career to recognize that the fact that we're now here demands of us a certain moral clarity and a moral action that the world needs a lot right now. Now, the fact is that you all woke up to come here on a Sunday morning. That's pretty good moral action. The question is, can we take it further? Thank you.